A very good day to our respective judges and audience. I am Tinwen.
And I'm Chang Shicho. We will represent Sekolah Menengah Kebangsaan Desa Pedanga.
We have carried out a project entitled AI Vision Based Suture Analysis and Decision Support for Robotic Surgery.
As an introduction for this project is actually discussing a methodology for robotic surgery that might have a huge impact on its performance, which is focusing on Wsdg 3, good health and well-being, as well as Wsdg 9, industry innovation and infrastructure.
As for the background, the project is taken out due to some realistic issues that are brought along by traditional suture issues, such as psychological tremors, criticism of force application, stitch spacing deviation, tension application, and obscure surgical field. To improve or avoid these issues, the use of robotic surgery becomes wide in surgery that needs high precision. Yet, current robotic surgery already integrates AI in certain tasks.
Therefore, it is actually emphasizing on consequences of excessive force, tissue trauma, knot tightness or slippage, needle deflection, and improper grasp angle caused by traditional suture. Here's an illustration for traditional suture.
I tied a square knot by 3-1 method. After that, I did a continuous suture. I spin my fist so that the needle could move following its shape. I slow down as the needle crossed the wound so I can adjust the exit direction and distance. I pull the needle out slowly to ensure that the needle exposed is 2 per 3. As in 14th second, 16th second, and 20th second, the shock inappropriate needle grasping. It actually limits the hand movement of surgeon, which causes slippage on needle and difficulty in controlling the movement of needle, as the fist is limited in a specific posture. As the surgeon note shows, it is actually a loose square knot of nylon monofilament. It can cause the knot to unknot itself during suture as the monofilament is pulled. And this is the final product of the suture. It shows irregular gap between each lines and different length of lines. It actually proves there is different force that is applied each time, which might cause excessive tension or lack of tension to the skin.
Therefore, we have an idea to improve the suture quality of robotic surgery. First, virtual needle point selection. AI provides virtual needle selection by illustrating a consistent projection needle that is moving according to the surgeon's motion to provide the surgeon a guidance to suture precisely.
Besides, another idea is to have a needle grasp point checker, which means AI checks the grasp point of the needle to prevent micro slippage, needle deflection, and clamping sweat area of the needle. Furthermore, is to have force application feedback, which means AI feedbacks force application of surgeon during suture consistently.
In Article 8, it states that needle should not be reinserted into the tissue. It clarifies that the needle have to move in the same direction, which emphasizes that the lines of suture shall have the same height and gap in human eyes. While in Article B, the needle should be grasped appropriately to improve overall performance during a suture task. It is mainly to avoid needle slippage. Whereas in Article C, it talks about force feedback technology. It shows that the main force applied is slightly lower. It clarifies that the wound should receive approximately same tension without the loose surgical knot.
Based on the text, do you think the methodologies given improves the overall performance of robotic surgery?
So based on the methodologies given, I think it could help improve the overall performance because it helps in like specific field, for example, how the structure when the doctor did, and maybe I think the needle point that need to select. I think all this is quite useful. Yeah.
Alright. Do you think the methodologies given are reliable and can be applied in the realistic situation?
Okay, based on what I have seen, the methodologies I think is reliable, but whether it could be applied in a realistic implementation, I think that need more clinical trial. Then only it can be proven. Yeah.
So I think your opinion is quite reliable as well. So I would like to ask, in your opinion, if this methodology is applied, who will be benefit as the, I would say, the realistic cases?
Of course, I mean, if this kind of methodologies can be applied, it will benefit for both, like for patients and the surgeon. Because for patient, they can have less suffer in the surgery, right? Because the wound will be more specific and maybe the cut will be smaller. And for the surgeon, these methodologies will apply and they could help them to diagnose the problem and maybe help them to take over some very small things. So I think they could help and then they release their stress from the surgery. Yeah.
You're right. In your opinion, AI should take over the surgical system or act as a role of giving advice to the surgeon when surgery?
For me, I would say I stand that AI should just giving advice for the doctor because human's body is very complicated. So if you let AI take over, the database of AI is based on common people. It means that most problem that human face, then they will diagnose it. But in the relative case, it doesn't. So doctor will need to use their experience to diagnose the problem.
As for the impact, patients with wounds that require high precision, especially in cardiovascular, neurology, oncology, and pulmonology, it has the potential to reduce the risk of intraoperative errors or surgical complications. Mistakes during robotic surgery can be reduced, and overall performance of surgery improves.
As for the summary, AI has its part in developing a more complete and higher performing robotic surgical system. The advice that are given by AI helps the surgeon to make surgery more precise. We have to mention that these methodologies are upgraded methodologies based on the current AI uses in robotic surgery to make it more complete. We believe that it increases overall success and precision of suture in surgery that provides benefits, and it will be more and more in the future. The functions of AI in robotic surgery are proposed